GambleAware Week aims to increase awareness of gambling and gambling harm in the New South Wales community. GambleAware Week 2021 took place between the 18th and 24th of October 2021. The theme for GambleAware Week 2021 is Let's Talk Gambling. Gambling harm is a significant issue for the Fairfield local government area. Gambling addiction and losses can have negative impacts on individuals and the people they are close to. They can often be linked to household poverty, domestic violence, family breakdown, drug and alcohol abuse, and poor mental health. The following presentation formed part of an online GambleAware Week forum held on the 19th of October 2021. The forum was for local community service providers to learn about the newly established GambleAware services available for southwestern Sydney. For further information on the range of services that have been brought in under the new GambleAware structure, please visit www.gambleaware.nsw.gov.au.
I'll be presenting on behalf of GambleAware Southwestern Sydney. So, from the 1st of July of this year, GambleAware, as many of you would already know, has become the new gambling treatment and support service in New South Wales. Like Gambling Help before it, GambleAware is providing support and counselling for individuals and their families in New South Wales and much more. The change to GambleAware is more than a rebrand. GambleAware is actually a redesign of how the New South Wales government provides gambling information, education, support and treatment all over the state. It's designed to connect more people across New South Wales to the right help at the right time from the services that are right for them. So why the change now? Gambling, counselling and support services have helped tens of thousands of people experiencing gambling harm for over 20 years all over the state. Unfortunately, however, many people in New South Wales affected by gambling were not getting all the help they needed. So the Office of Responsible Gambling took a hard look at the system New South Wales had in place to see what was working and what wasn't. They found that despite the vast range of services available to people affected by gambling harm, many did not see themselves as candidates for those services, and stigma around gambling was a barrier to seeking support. And people didn't realize how much free confidential support was available before they reached the crisis point with their gambling. There are also challenges in coordinating services in some geographic regions and reaching disadvantaged individuals and communities when they needed support the most. So as a result, GambleAware has created 10 regions in New South Wales that align with local health districts and primary health networks to better integrate them with local community and health services. That means we're all now in a region overseen by a specialist GambleAware provider dedicated to providing support to everyone impacted by gambling harm throughout the whole region. This model ensures that support reaches a large proportion of people experiencing gambling-related harms in the state, and we can deliver high-quality support and treatment in a way that is responsive to their needs. So in today's forum, we'll be discussing some of the ways that will be happening. The new GambleAware website, gambleaware.newsouthwales.gov.au, provides more gambling information and access to a greater range of support. Coming soon, people will be able to create a free account, and in doing so, receive a unique ID and be able to schedule counseling sessions with their regional GambleAware provider in real time, change appointments, manage their personal details online, and access a range of additional services. And more information is also available on social media platforms. The new GambleAware digital platform is something that will be coming very soon as well. The Office of Responsible Gambling has invested in this technology to improve the service experience for people seeking help and to provide more self-help options as well through apps and digital tools. There will also be a greater access to specialized counselors within the GambleAware framework that that creates more ways for people to speak with a counselor one-on-one, whether by video, online, chat, email, over the phone, as well as in person. And as a result of all of these changes, there will also be an enhanced data collection process and reporting to enable continuous improvement and evaluation of the services that are being offered to those who need the support. Currently, the GambleAware website provides information for the community, health professionals, industry, and community organizations to learn more about gambling, how to identify gambling harm, and also how to seek support or support somebody who's experiencing difficulties with gambling. Later this year, the website will enable clients, as I've already mentioned, to self-direct the level and type of support and treatment that they receive, and it will also enable them to seek and access support at a time and mode that suits their preferences. For example, a person experiencing gambling-related harm can utilize digital self-help tools when the need is most acute, whilst also utilizing an online platform to book sessions at a time convenient to their schedule. And this also means that people living in regional or remote communities will have access to services that are comparable to those living in metropolitan areas. Digital modes will increase the optionality and enable the delivery of services and support to more people, including those who have difficulties accessing services in the traditional ways. Now, if you ever need support, and this is to anyone, anywhere, the information is, you can see at every one of these slides at the bottom right-hand corner. You can call this number 1-800-858-858 GambleAware at any time, any day. We'll be able to set you up for the support that you need in the particular region that you may be in, or that your clients may need in the particular regions that they may be in. The new GambleAware service delivery model comprises some of these elements that you see here and integrates them together in a way that involves a no wrong door approach, enabling individuals to choose how they want to interact with the system. So a key component of the system is the redesigned GambleAware support and treatment program, which I've already discussed with everybody today. And hopefully this allows us to reach our goals, reaching a larger proportion of people, especially in Southwestern Sydney, in particular, Fairfield area. So the service delivery will be underpinned by the digital platform, enabling a step care model, including referrals, scheduling, and also the various modes of support that we've already discussed. This will also include additional offerings such as peer support and client guide offerings. And the hope is to be able to establish a quality standards framework and implement data-led stewardship and resource allocation across the network by the Office of Responsible Gambling. And all of this is in the hope of ensuring that there will be no wrong door to accessing support and treatment, and aims for any individual experiencing difficulties to choose how they want to interact with the GambleAware system. There is a lead GambleAware support and treatment provider responsible for each of the 10 New South Wales regions. I'll just mention a couple of them today. You can see on the screen, there are 5 regions in metropolitan Sydney, and the University of Sydney, and formerly we were known as the Gambling Treatment and Research Clinic. So we are responsible for 3 of the regions, being the Blue Mountains and Western Sydney, Central Sydney, and Southwestern Sydney as the lead provider. And we are working with several service partners in order to achieve the objectives of the GambleAware program. Our staff are all appropriately skilled and qualified and consist of psychologists and clinical psychologists registered with APRA, social workers registered with the AASW, counselors accredited with PACFA or ACA, and also financial counselors accredited with FCA and FCAN. Most of our staff are also trained and qualified supervisors, which means that we're fully prepared to train and supervise staff in the range of treatments from online with therapist assistance to the effective management of the most complex cases as well. As the lead provider at the University of Sydney, we are ensuring that clinicians working in all of the services across the region, in particular for our purposes today, the Southwestern Sydney region, are well supported by both individual and group supervision, as well as training designed to enhance their clinical skills. We also have a clinical intern program that's been operating for over 12 years, and in that time has provided internships to over 80 intern psychologists. Now, GambleAware Southwestern Sydney. Successfully treating and supporting gambling difficulties requires a holistic approach that addresses multiple factors that would determine the success of treatment. To this end, our partnership is with CatholicCare Sydney and Uniting, formerly known as Parramatta Mission. Together, they'll be providing with us a suite of wraparound services that will augment the provision of holistic care in the region. Now, just a little bit about our university clinic. We've been around for over 20 years, and we've specialized in working with complex presentations for gambling, including a range of comorbidities, substance use issues, mood disorders, personality disorders. We've also offered dialectical behavioral therapy groups for clients with other sorts of addiction issues and complex needs. as well as family supportive therapy, couples therapy, and Aboriginal specific outreach programs, as well as outreach in transitional centres and correctional centres. So I'll just say a little bit about CatholicCare Sydney, who provide, and later on Ilona is going to say a bit more about CatholicCare, but CatholicCare Sydney, one of our partners, provides financial counselling, money management programs, family relationship counselling, pregnancy support, addiction and other mental health support, child and youth services, school programs, carer support and disability services, among other services. And Uniting, which Samaya is going to say a little bit more about later in the presentation, Uniting, they offer a comprehensive range of quality wraparound services, including financial counselling, general counselling, peer support groups, family and carer support services, domestic and family violence services, youth support services, homelessness and housing support, aged care services, and community participation services, and also many more services. So bringing all these services together under our direction as the lead provider will allow for greater evaluation and quality control measures to ensure that the services are flexible, thorough, and relevant, most importantly, for clients' needs all throughout the region. And this will allow us to have a greater integration of these services as well, and also working with other complementary services in the community, allow for a comprehensive provision of services to support our clients. And I've already mentioned our service partners. Here are the locations where we're all operating. So in Fairfield, we've got CatholicCare and Uniting. In Bankstown, we've got CatholicCare and Uniting. In Liverpool, we've got CatholicCare. And then in Campbelltown, Bonnyrigg, as well as the Wallandilly and Wingecarribee LGAs, we have us, the University of Sydney, to provide appropriate regional presence and service coverage for all of southwestern Sydney. In addition, and this is a very important focus of the new GambleAware program, there will be increased community engagement. We'll have dedicated community engagement officers employed in the region to work with the community, to work with you all through outreach and engagement initiatives. This means we can hopefully support more people who need the help, particularly in Aboriginal and multicultural communities. We're essentially adopting a model for community engagement that allows us to achieve these objectives. As I've already mentioned, effective service coverage. Second, we're having someone dedicated to this role, which is new, because in the previous program, it was always clinicians playing a dual role of also engaging in community with the community. And now we have specialized community engagement officers. We'll also be leveraging new technologies and communication strategies to link community organizations across the region to increase referrals and pathways. And also importantly, we'll be integrating with the GambleAware statewide Aboriginal service and the GambleAware statewide multicultural service, the latter of which is yet to be announced, but will be forthcoming. Now, the way that we are setting up our community engagement, it's important to note that all of the clinicians, the psychologists, the counselors will continue to be engaging in with the community as well, and working in liaison with the community engagement officer to make sure that we can continue to build on the good work that we've done in the past and into the future, help achieve all of the goals that the community has towards addressing gambling harms. A very good example of a way that we have leveraged technology and kind of our reputation as a leader at the University of Sydney in education, training and research has been our journal club. The journal club has been operating for over 12 years. I know some of those on the call today have been participants at that journal club, and we meet to network and discuss the latest research, and also to hear from invited experts on a range of topics. And that's something that we will continue to be doing into the future. We'll also be continuing to offer forums to connect with the community, and also meeting the community where they are. So whatever it is that we can help with, like I tell Fairfield City Council all the time, whatever we can help with, you just let us know, and we'll very likely be able to do it. Just never hesitate to ask, and hopefully we can build our relationship well into the future, because we have been funded under this program for 5 years. Now, the community engagement officers will be doing very specific tasks in their roles as well. They'll be designing and coordinating events for target groups to increase the profile of and delivery of the key gamble-aware messages to reduce stigma, increase referrals, develop social media campaigns, writing media releases and speaking with the media as well, building relationships with external providers across the region, and also all of the gamble-aware counselors across the large region, and producing promotional and educational materials that comply with the GambleAware brand and are suitable for communication to a variety of target audiences, and as well as just working closely with all of our staff, to make sure that that we can manage any increased referrals as well coming from any events or campaigns, and ultimately developing and delivering community-based education sessions and support sessions for a range of audiences, including community health and cold organizations, such as sessions like we're in today. Now, importantly, I've mentioned before the no wrong door policy, but I want to say a little bit more about it. It aims to bring together a diverse range of government, non-government, and community managed organizations to achieve the mutual aim of reducing barriers and enhancing support for clients with complex and perhaps multifaceted needs. So no wrong door approach means that every service in the GambleAware program should be able to refer a client to any other service they require from multiple points of entry, and all services must respond to the individual's needs, either through providing warm referrals and case coordination, or providing information about the services that the client can offer. So we'll essentially be using a step care model to assess clients' risk level and clients' needs before booking appointments and making referrals where necessary. And clients should be guided to the appropriate facilities, and we'll have follow-up from our client liaison officers to ensure that they receive appropriate care. Now, in terms of other organizations, such as maybe yourselves, we can make specific referral arrangements with other services in accordance with your policies, since we have no wrong door and we want to reduce the barriers or burdens on clients, knowing how difficult it could be to connect with our services in the first place. In short, the wrong door policy fits our, the wrong door policy is really our welcome sign. It doesn't matter how a client gets to us. We'll take anyone, anyway, anytime, anywhere. We just want to be able to help. And through GambleAware, we believe that we now have what it takes to help everyone that is in need. Now, stepped care, as you may already be aware of in other domains, is an approach to service delivery that enables multiple client entry points to support and treatment depending on their need and preferences. So clients are able to traverse between varied modes and intensities of service in a way that is responsive to maybe the geographic location, the preference for anonymity, the readiness for therapeutic treatment. For example, some people may opt to utilize digital tools and other functionalities online rather than participating in a counseling session. And similarly, some low-risk clients may have been attending counseling sessions for some time and are like to engage with a lower intensity of assistance, such as a self-help resource. So our step care model is based on national guidelines for mental health care. So it is best practice, and what it designs to do is to assign levels of care from level 1 through to 5, which I'll say more about in a moment, up to level 5, which would be the highest intensity of clients and their difficulties with gambling, such as comorbid issues, maybe homelessness, severe mental illness, physical disability, substance abuse, extremely high levels of debt, or critical events in their lives, concerns with self-care, extremely long history of gambling, and so forth. So to optimize engagement with our services, clients are matched to the least intrusive mode or level of intervention. And also just in terms of the step care model, it's designed in a way that we're able to provide a variety of different interventions and clinical service options as well as non-clinical service options as required. Here is just a very basic outline of our step care model. We have low levels of risk to very high levels of intensity, as you can see, from levels 1 through to 5, at-risk gambling, moving up low intensity, moderate intensity, high intensity, and then acute intensity client. And as I've already mentioned before, this is the step care model that we're implementing very carefully to ensure that the service options and the integrated referral pathways that we could recommend are all in place. And we look at the step care in terms of gambling levels and history, in terms of treatment history, social support of clients, and their coping skills, financial stress experienced by them, and perhaps suicide risk and other sorts of critical life events, as we've already mentioned. We offer a range of services, including free and confidential face-to-face online and phone counseling, psychological treatment for gambling, and counseling for partners and family and affected others, financial counseling, self-exclusion from clubs, hotels, and the casino, and outreach work to different groups in the community, as well, as I've already mentioned, and educational and self-help resources that have been provided through the GambleAware, but also resources that have been developed in-house at the University of Sydney. And I would like to, at this point, turn the time over to my colleague, Ilona, who will be speaking to us about CatholicCare Sydney, one of our service partners.
Hello, yes, thank you so much, Michael, for giving that big overview of what GambleAware now does. I also wanted to add to that, I guess, CatholicCare. So CatholicCare Sydney is partnered with Sydney Uni now. We're going to provide services in Southwest Sydney, also Central Sydney. But I'm mainly here to speak about Southwest Sydney today. So CatholicCare Sydney has been around for a long time, actually, since 1940, and it was founded by a group of women who really wanted to focus on supporting children, families, and individuals. And I guess that value still is the core of what CatholicCare does nowadays. CatholicCare has a lot of different services. I've only been with this organization for 3 months, but I have been a gambling counselor for 8 years. So it has been a really good sort of crash course in learning what CatholicCare does. And I'll just give you a super brief overview. So they do cover charity and volunteer services. They also have children and youth services, community services, disability services, family and individual services, and senior services. Next slide, please, Michael. But I will talk about the family and individual services because that is where GambleAware is nestled within. So they do offer parenting groups and education groups, which are short courses, usually happen online. They also offer My Kids and My Group, My Kids and Me groups, which is primarily focused in Southwest Sydney. It's for groups of parents with children in out-of-home or kinship care. They teach parents new strategies and provide connections with other parents for emotional support. There's also the Keeping Kids in Mind group, also in Southwest Sydney, which is a 5-week course for separated parents experiencing ongoing conflict. There's also parenting counselling, which is telehealth mostly. There's also a parent line in New South Wales, which I've provided the phone number for. They also offer pregnancy counselling, which is telehealth, and offers 12 free sessions to any person with pregnancy concerns. And there's also the HOPE program, also in Southwest Sydney. They provide one-on-one support for young women aged 16 to 25 years of age who are pregnant or have a child up to 18 months old. Family support, children and youth. I'll go to children and youth first. So there are a lot of school counsellors as well in selected schools around Southwest Sydney who are working for CatholicCare. There's also children and young people sexual assault support services, which offers therapy, advocacy, court preparation, and support. Also the Cook and Phillip Youth Program, which is telehealth. It's kind of cool. It's like it's providing it's helping to reduce barriers for at-risk youth to get into education, work, or just life. And then relationship and separation, there's a whole raft of services around this. There's actually a big relationship center in Bankstown, which a lot of these services are based out of. There's also the Diffuse program, which is based in Fairfield. It's a men's anger management program. There's a Choosing Change program, which is also a men's group, and also CatholicCare also provides support for male victims of domestic violence, which is fantastic. They also support parents who are going through separation, so with case management, mediation. They also run Our Kids groups out in Bankstown, which is a 7-week group for kids going through separation. And CatholicCare also helps to provide services for just separation, children's contact services, so providing parents with supervised care around supervision visits. And family support, which is where GambleAware sits within. So we have family recovery program, which is more around central Sydney, but they provide groups and support for families impacted by other family members' AOD and gambling issues. So any kind of addiction going on within families, they would then look after those families and help them through that. And CatholicCare also just offers counseling, financial counseling, parishioner programs within certain churches, and also then there's us, the GambleAware program. And so there's a great map, which is an overview of what areas CatholicCare does service. There's different funding bodies that they get money from and support from. So there's New South Wales Health, DCJ, DSS, now the ORG as well. If you have any questions or want to know more about CatholicCare, I would really urge you to call CatholicCare's inquiry and hotline, which is Careline. The number's there, 13 18 19. It's basically also the central intake line. So you could call them up, have a chat with them, figure out what is needed for yourself, your service, or your clients, and they'll refer you on to one of the services within our organization. And that's about it. Thank you so much.
Thank you, Ilona. And now we'll turn the time over to Sumaya from Uniting, another of our service partners.
Good morning, everyone. So I'm Sumaya. I work as a GambleAware counselor. GambleAware. Yeah, so I want to give you a brief overview of, huge range of services that Uniting has to offer. As you can just see on the slide, they have a list of services from aged care, family services, retirement and independent living, early learning and childcare, disability support services, foster care, youth services, and then there's disability support services, and as well as range of mental health services. Again, even in the range of mental health services, that's divided into youth program from 12 to 25, and then for adults, and then NDIS as well. And another program is counseling and mediation service. So, but in this forum, I'm just going to give a very brief overview of the services that we offer in Southwestern Sydney. So if you have a look at this slide, these are the services for mental health services and counseling and mediation services. And for example, because there are so many services that we offer, it can become a little difficult for people to understand which service to go on to. So the easiest way is, one, you go to the website of the Uniting, and then if you scroll down, you can actually find a service by just entering your postcode. So you enter the service, you will have a list of services which are near where you live. You look into them, and then you access the service. Or the other way to access the service is to call the central line. Can we change the slide, please? Yeah, so the Uniting national number is 1800-864-846. So you call the number, and then you press to, you have a customer service agent taking up your brief information, trying to understand what is the service that you're after. And they will guide you through, and you will be connected to the service that you're after. Like, for example, I've mentioned over here, the Uniting Youth Enhanced Support Service. So with this service, you have, you talk to the counselor, the counselor will take the required information, and an intake appointment is given for the client. And you can either self-refer yourself or have a GP's through a GP. And the number of sessions really depend on the client's need, and they are unlimited. Besides that, we also have Headspace service with us. So Headspace usually offers around 10 sessions, but with us, it really depends on what the client needs. With this service, if you are between 12 and 25 and you need more mental health support, The service is tailored for the individual needs of the client, and it might be from psychological. And with the counseling and mediation service, which is just in Campbelltown and Fairfield, as you can see on the slide. So this particular service, again, the counselors are professionally trained trauma-informed counselors, and they have the necessary skills to help anyone with, to build healthy relationships, manage conflicts, and share positive communication. So yeah, that's it about this particular service. And the mediation program that we have, it aims to reduce the conflict and promote positive relationship while emphasizing productive co-parenting for the clients who come in. Now, all the services from aged care, retirement, early learning, disability support, youth services, they are all there in Southwestern Sydney, depending on the location that you're in. And mental health services and counseling and mediation, these are, so in this particular area, YES service and the NDIS mental health and improved living and health well-being, these are the only two services from mental health. And apart from that, I've listed the locations which are in Bankstown, Canterbury, Liverpool, Fairfield, and so on. And besides the Uniting Counseling and Mediation, we also have Gambling and Financial Counseling, which is a part of University of Sydney, a GambleAware program. And if somebody is also requiring general financial counseling, we also have a tie-up with National Debt Helpline. So anybody who is in debt and they are looking for some sort of financial counseling, they can ring up the service and talk to a financial counselor and get the required help. But with the gambling and financial counseling, of course, which is particularly focused on gambling, so we have a number which I have mentioned here, which is 0298916212. So if you ring up this number, myself or another counselor who works in Parramatta, either one of us would probably answer the call and take the warm referrals. And even if the clients who are not specifically looking for, if they call, and we've had a lot of clients calling in, and they might not even look for gambling related help. So we make sure that we just don't leave the client there. We connect them to the appropriate service. I've had one client who was looking for general financial counseling in Fairfield, so we help them connect with the Salvation Army and financial counselors there. So yeah, and the registration process with the GambleAware is pretty much the same as with University of Sydney.
G'day everyone. To understand what I've been doing, I need to go back in time a little bit. In 1999, I started as a gambling counsellor, and through that period, I noticed Aboriginal people weren't seeking services. So that led me to do some research with Southern Cross Uni and Central Queensland University around particularly Aboriginal population and help-seeking behaviour, even looking at therapeutic and treatment models. And then after that, after 6 years, I ended up getting a contract with the Office of Responsible Gambling about doing a specific Aboriginal service. So we've been now running for about 7 to 8 years, and it is all about looking at the culture, looking at the identity, values, beliefs of Aboriginal people, and how it's impacting their help-seeking behaviour. And obviously, it needs to work together with the GambleAware services because they're providing a service that needs to be culturally appropriate. So from 2022 onwards, I'll be focused mainly on working with the GambleAware providers to see what type of culturally appropriate services they provide. I'll be evaluating, providing recommendations because, at the end of the day, we want to ensure that we've got the right model, the right treatment models, the right engagement, the right training for people to engage our population. So that will happen in this area, and I'm hoping that Aboriginal services, Aboriginal community are aware of GambleAware providers, they're engaging with the services, and also that we want Aboriginal people to finish their treatment. So if they're coming to your service, we want them to stay. And I know for a fact, and you guys all aware, that Fairfield and large parts of Sydney, we have different population groups, but I do see a lot of similarities, and I think we can learn from each other around what's best for our populations. I'm not saying Aboriginal people are significantly different, but we need to really understand our population for us to do the best service possible. And that's where, yeah, I will be working with the GambleAware providers, CatholicCare, Uniting, and the likes mentioned earlier. So hopefully I get to come down there soon and join you in this battle. But that's all I wanted to say. But hopefully my contact details are there. If anyone wants to talk about culture, identity, the impacts of gambling, obviously, and its relationships. So please feel free to contact me if you want to talk about your culture, your population, and the research that I've done. Thank you.
Thank you for viewing these presentations. If you or anyone you know needs more information on gambling services available, please visit www.gambleaware.nsw.gov.au.